It's one of the leading causes of death in the U.S. today. Every year, millions of people suffer from vascular disease, but one type is considered a silent killer, striking older men and women without warning. It's called abdominal aortic aneurysm, or also commonly known as AAA.
An abdominal aortic aneurysm, or AAA, is a ballooning or thinning of the wall of the aorta, the main blood vessel through the abdomen. This can occur in people who are smokers, it occurs more commonly in people who are older, and it can occur in people who have a family history of AAA. When the aorta is thinned and the wall is weakened, the aorta can rupture, and that can cause serious intra-abdominal bleeding.
The risk factors for abdominal aortic aneurysm are smokers, people over the age of 60, and those with a family history of the disease.
I was suffering from pneumonia. In the process, my primary care physician determined that I had an enlarged heart. And in screening at the cardiac unit for that, they determined that I had abdominal aortic aneurysm, which was accidentally determined. When they diagnosed my condition, determined that I had an abdominal aortic aneurysm, I was very much surprised. I had absolutely no symptoms whatsoever of any discomfort.
Because abdominal aortic aneurysm has no symptoms or warning signs, doctors say the condition can be easily overlooked during medical exams. As a result of this alarming fact, the Medicare system now provides a one-time Medicare-covered test for those individuals at risk entering into the Medicare system.
Medicare now offers a screening benefit to patients who are entering the Medicare program. Men who have ever been a smoker, or men or women who have a family history of aneurysm can be screened. The screening test is simple. It involves an ultrasound study to look at the aorta in the abdomen. It's a simple, painless, and non-invasive test similar to the types of ultrasound that are done for other conditions such as pregnancy evaluation or looking at a gallbladder.
But for those who are diagnosed with AAA, there is still hope. A stent graft system is a new minimally invasive alternative to traditional open heart surgery.
The traditional way to fix an aneurysm was with an open operation to replace the aorta where it had ballooned out. Now, less invasive options exist for treating aneurysm. A stent graft, or covered stent, is a device that is inserted into the aorta like a liner, where the aneurysm is excluded from the circulation and the blood flows through the stent graft.
Well, in the process of screening, when they determined that I had the abdominal aortic aneurysm, was quite surprising. And I truly believe that seniors, now that Medicare covers it, should take care to be sure that they don't have something of this nature, because it is something that a person knows nothing about until maybe something disastrous happens.
Medtronic, a global leader in medical technology, is helping give a voice to the silent condition of abdominal aortic aneurysm by spreading the word about a Medicare screening that can help save the lives of many older Americans.
Awareness of abdominal aortic aneurysmal disease and the risk of rupture is vital because approximately 15,000 Americans die each year from a ruptured abdominal aortic aneurysm. What happens is these patients are unaware that they have the disease, and their aorta will rupture, and they will either die at home or potentially die in the hospital thinking that they have the flu, and in fact they have a ruptured aorta and they're bleeding to death in their abdomen. So it's important for these patients to be educated about the risk of the disease and then to get themselves screened through an ultrasound screening so that when they find out they have disease, they can get appropriate treatment.
My physical condition prior to the time they determined I had an aneurysm, I had no knowledge, nor did I have any physical disabilities. Since I've had the procedure cared for, I still have no knowledge or no feeling of a disability whatsoever as a result thereof.
With an overwhelming number of seniors dying from the disease each year, the Medicare-administered screening is proving to be a true lifesaver.
Our mission at Medtronic is to alleviate pain, restore health, and extend life. We're excited about the Welcome to Medicare screening for abdominal aortic aneurysms because it will enable thousands of patients who didn't know they have the disease to find out they have the disease and to potentially get treated either with Medtronic's technologies or with other technologies that will save their lives.